Thanks, Tom. Good morning, everyone. This is Sarathel Burgess-Burnett here, Deputy Commissioner, Children's Services Division. I am really happy to be with all of you on this Thursday morning. Thank you again, as always, for taking time out of what I know is your very busy day. We've got a hefty agenda, as always, and so we're going to keep you busy all the way through. I'm only going to be with you a couple of minutes, meaning I'm just going to go do a couple of updates, and then I'm going to move on and let the rest of the team fill in and give you updates. And then we do have a couple of presentations for you today as well. So let's go ahead and jump in, Tom. Next. So we do have a couple of presentations. I know our fiscal team will be here with you this morning. SGA, mental health, is going to do a presentation. In addition to that, teaching strategies will do a presentation today as well. So I'm going to go ahead and give us an opportunity to get started. So next slide. So I'm just going to cover a couple of things for you this morning. I just want to make sure that all of you are aware that as we are moving through the summer, ending a program year, it's amazing. We're already here almost at the end of June, which means 2021 is passing us by really quickly. But just as a reminder, we are going to be prepping and moving forward into our next program year. We've already received information from the Office of Head Start with their plans on making sure that everyone is aware that their plan is to have full opening in the fall. What Office of Head Start is looking forward to is in-person learning in all of our classrooms at licensing capacity. Right now, we do know that there is a licensing update that you all have access to, including on the Sunshine website, that gives you, again, licensing updates on what is required. What we do know, we are still requiring masks in early learning centers and settings. And we know that our young children are still not that group that's being vaccinated. And so those health and safety requirements are still intact. And we'll go through into the fall. But Office of Head Start, through Administration of Children and Family Services, has put out program information on Head Start. And what they're asking for is everyone to understand when it comes to program year 2021-22, the anticipation is that we are going to be full, operational, opening classrooms, fully enrolling to your licensed capacity, which means, for example, if you're serving 3-year-olds, you've got a classroom of 17. You're serving 4-year-olds, you got a classroom of 20. Again, so planning forward for your strategic recruitment, marketing, enrollment over these next couple of months to try to make sure that you're able to get to full enrollment and in-person services. One of the other things that I do want to let everyone know, and I know the question has already come up to me from a few people, virtual and remote was an interim strategy. It was never intended to be the methodology that we would use in Head Start going forward. In this same document, what it states is this is an interim strategy, and the only way we will go back and be able to do anything with virtual and remote is if there is a health emergency or some emergency that causes you to not be able to operate your center-based program. And so we are moving back, we're going back, we're looking forward and looking ahead and planning for a kickoff for fall of 21-22, moving into that program year, looking at everything we need to do to make sure that we're able to open up our doors, that we're able to fully serve families in your community. And so again, when it comes to URSEA, is doing your eligibility and recruitment, but that recruitment is key. Making sure that parents know that you're going to be there, making sure that parents know that you're going to be fully operational, letting parents know that you're going to be doing in-service. We've been disrupted for 18 months now. Parents need to know what the plan for the fall would be in your program. Please don't make any assumptions that parents know. Just because we communicate this to each other, it doesn't always get into our communities, and our parents don't always know what our plans are. And so what I'm recommending you do is do full marketing, recruitment, and information sessions with your parents and letting them know what your plan is for the fall so that they can plan forward as well. And so again, if there's virtual and or remote, it will be only approved if there is an emergency. So know that in the fall, when we are looking at your classrooms, we will be looking at them for in-person services across all of our programs. The other thing that I do want to remind everyone when you're moving forward, when you're thinking about that, Office of Head Start is going to start looking at enrollment in September of 2021. They're going to be looking to see where are we with enrollment. That's why it is so imperative that all of you are working hard to make sure that you're enrolling 0 to 5. They're going to be looking at early Head Start. Of course they are. They're going to be looking at Head Start. Of course they are. Understand that our PFA, Early Childhood Block Grant through City of Chicago, they're going to be looking for enrollment as well. And so what we need everyone to do is really gear up. I know that marketing materials were due to start coming out to all of you, but we want to make sure that everybody is doing everything that they can to reach full enrollment in all of your classrooms. The first month that Head Start is going to start evaluating full enrollment. And when I say evaluating full enrollment, is they'll be looking at grantees to see whether or not we're under enrolled. And if we are, then we're on an under enrollment mandate. And then we have to put strategies in place in order to get out of that box that we would be in at that particular time. Hoping not to get there, hoping that in September that we've been able to accomplish enrollment, and that steady enrollment will go through and throughout the program year. And when they start looking at us in January of 2022, we will have full enrollment, and that we won't go into where we were pre-COVID. Just before we went into COVID, everyone needs to understand we were on an under enrollment mandate both for Head Start and early Head Start. We do not want to go back and repeat that. What we want to do is maintain enrollment across all of our funding. And so again, we'll be working with you on strategies and everything that we can do to make sure that we are enrolling, that we are fully enrolled, that we're using our marketing materials, that we're recruiting, that we're communicating. We're doing work here on our end. We've got collaborative partners out in community, letting them know that you're out there, letting them know that there's seats available. We have meetings on Friday where we're looking to see where people are. And so again, the last thing I'm going to say is I want to remind you that there is that application for your 3 and 4-year-olds at chicagoearlylearning.org. Send your parents there to make sure that they're enrolling, that they're finding you, making sure that they know that they can find you in that system and that they can apply for a seat in your program. We know many families are going to walk directly into your door, but when they walk in, have your staff ready and able to communicate with those parents, to draw them into you, to get them through the enrollment process so that we're fully enrolled when we reach September and maintain enrollment throughout the program year. And so I'm not going to beat it up any more than that, but I just want to make sure that everybody understands that this is where we're going. Again, we want you to, and through your recruitment, we need you to prioritize eligible families. We know that there are many, many families out in community who, for example, have lost jobs through COVID. Some of them are still struggling, trying to get themselves back on their footing. They're eligible for Head Start. They're eligible for preschool for all. They may not be eligible for CCAP, but through your family engagement strategy, you can work with a parent who's Head Start PFA. You can work with that parent. You're getting paid or you're funded for them through those funding streams. Working with that parent to help her get a job then makes her eligible for CCAP. And then you have that third funding source. So I want you to think about your strategies on helping parents get into your seats in your program, and thinking about how you might be able to encourage some parents to come in talking about some of the other things that you do with and for families through your family engagement programs. There is some information that's going to come out regarding home visiting as well, and making sure that we understand we are going to be looking at going back and doing in-person home visiting, but we're going to send out some information that's going to give you more strategies around that. And so that's coming forward. But again, we're looking at home visiting being done face-to-face as well, starting in the fall. And so we'll be moving forward and talking more and giving you more information as we move forward through the summer. And so I'm going to go ahead and I'll stop. And I will say whoever is going to talk about the operations update and the child transition tracker, I am turning it over to you.
Thank you, Sarita. Good morning, everyone. Elaine and Seth won't be joining me this morning to talk about these items, but I will be speaking to them. and they are right now working on the child transition tracker. So on this tracker, Sarapel sent a memo on June 16th to all of the directors. If you didn't get it, please email me and I will send it to you. But what we are doing to prepare for the June 30th closeout of the base grant, and this is for Head Start and Early Head Start, we are preparing a weekly transition tracker. This document will detail the transition of all of the Head Start and Early Head Start children on the base grant and showing the full transition. We will need to know and present to the regional office every child on that grant where their next placement is. So you receive the tracker, you receive the guidance for the tracker. So we are saying that this may go through the summer months. It pretty much will go through the summer months. So I have a few asks of you directors as you work with your staff. Please do not modify or alter the tracker in any way. The reason we're asking your staff not to modify it is because we then have to take that information and transpose it into one running document for the region. Please do not lock it and send it to us in a PDF. We need to be able to have those peoples open. We have locked the columns. So all your teams need to do is put that information in. It will be sent to us by your staff weekly, every Tuesday by noon, because we have to then turn around and get it off to the regional office. So if there are any questions, if there's anything that didn't come across to you, as I noticed that I may have had some audio issues, please feel free to reach out to either me, Elaine, Seth, or your DFSS monitoring team lead. It's very important that we get this tracker done. All right, so now I'm switching gears a little bit. And Tom, if we get any questions, please just let me know. To our annual Health Services Advisory Committee. I would like to personally thank all of you and your staff, your board representatives, your families that have participated in this year's HASAC meetings. We've had meetings, as you know, and subcommittee meetings representing the various content areas, and we have had full participation. So we would like to thank you. We would also like to thank our subject matter experts that have also participated in these meetings. Our year-end HASAC meeting will be held tomorrow, Friday, June 18th, from 10 a.m. to noon. If you haven't received that link, please reach out to us and let us know, either myself or Seth. This meeting is open to all Chicago early learning programs, their families, and community stakeholders. So we look forward to you joining us tomorrow. All right, those are the updates for the operations team. And so I'm turning it back over to, I believe, Sarapel or Latasha or Tiffany. Oh, program development and quality. I'm turning it over to Latasha.
Hello, everyone. Actually, we're turning it over to William. He will be doing the updates for quality today.
Yeah, perfect. Thank you, Latasha. Thank you, B. Good morning, everyone. For updates, as we have very few updates, as you see on our screen, we are still due for our PI questionnaires. The link was issued in our previous week's CSD. You can see that again. It was sent out on yesterday. Please revert to your CSD update. and as well as Tamela has just put it in our chat as well. Thank you, Tamela, for that assistance. The deadline on those PI questionnaires, there's a requirement of our PI program, our early childhood block grants, and that deadline is 6/30/21. Please make sure that again your agencies are and your sites are completing that questionnaire for all PI programs. Our continuity relationships basic training, we had our first session on the 15th, and today at 1 p.m. is our final session for the basic training for this program year. Tamela.white@cityofchicago, if any of your education managers, your US EDPDs, also your site managers and directors would like to have access to this training, we can do an immediate registration. Please see Tamela, please email tamela.white@cityofchicago.org so we can get you into that 1 o'clock training. It's from 1 to 3 p.m. via Zoom. Also with our scholarships program, we have been able to really tap into our goals as DFSS. Our goal is to make sure that all of our teachers are qualified as it relates to degrees, as well as our credentials through Illinois Gateways. Recently, we have just awarded an additional 25 individual scholars the opportunities to level up their credentials. These emails were sent out in the past week, in the past 2 weeks actually, and we have these individuals enrolled in our programs. I sent those emails out personally to congratulate them and to also get the final application so we can start that start them in their credentialing training and coursework. Also, in addition with our scholarships as it relates to our credentials, again, in aiming to reach our goals, one of our focuses recently, we've just sent out surveys as we're looking at our PFA classrooms. It's 2021 now. We have a goal of 2024 to ensure that our PFA teachers indeed do have those Pell degrees, those Pell licensure programs and qualifications as it relates to be teachers of those PFA classrooms. And that is our focus. Again, we're still gathering that data. And again, we'll be reaching out as it relates to next steps in ensuring that we are, again, supporting across the board all of our teachers in acquiring these requirements as it relates to the PFA program. All right, thank you. That's it for our updates. If there are any questions, please post them in the chat. And again, you can email again william.hill@cityofchicago.org. I'll place that in the chat as well. And thank you. Next slide, please, Tom. Enrollment.
All right, William, great. That was a great update. In terms of enrollment, we wanted to provide the enrollment across all of our different programs. Head Start, I always like to, whenever possible, let you know that we're funded for 9,274, which was never our intent to be funded for that many, but neither here nor there. That is the number. So we're at 57% enrolled, and these are all April enrollment reported numbers, by the way. So we've enrolled 5,263 Head Start eligible children. Early Head Start, we're funded for 2,162. And we've enrolled 1,683, so 78% enrolled. And our child care, our CCP, Child Care Partnership Grant is funded for 1,100. And in April, we enrolled 718, 65% enrolled there. Our expansion grant, expansion of Early Head Start, we're funded for 200 slots. And we've enrolled 149, 75% enrolled. Our Preschool for All program, we're funded for 5,935 and enrolled 4,118, that's 69% enrolled. PI Center Base, we like to break those up just so you can see, but PI Center Base, we're funded for 3,100 and Home Base, we're funded for 1,658. And you see Home Base is doing a little bit better. Actually, the best one out of them all, which is 87%. Still not 100%, but just looking at the percentages there, definitely doing a lot better in PI Home Base. And PI Center Base, we're at 69% enrolled. So those are the enrollment numbers. I think I just want to reiterate what my Deputy Commissioner mentioned about full enrollment. And we're going to be looking to, make sure that we are working towards full enrollment. And so right now, these numbers don't necessarily reflect that. So we do have some work to do. One of the things that, that the sites that wind up ordering the recruitment banners and other materials, you should have received those. I think we sent them out to 190 sites over those who ordered. Then you should have received them between Monday and Tuesday of this week. If you have not, definitely let me know. But those who ordered them should have them. And we actually put in the CSD update that we're really wanting to go ahead and kind of capture the moments. We want, oh, thank you, Peter. Peter said they look great. Thank you, Peter. We're hoping that they do look great. We want people to use them, guys, right? You get them in the, you kind of get them delivered, take them out the box. Obviously, Peter has done that, right? He's done that. But more importantly, we want you to use the materials. Get rid of your old banners. Let's go ahead and put the new fresh ones out. Let's go ahead and make sure that we're, putting the literature that's provided into the community. And we're asking if you guys are taking videos or pictures of your recruitment efforts. Please send us those, because we want to be able to highlight the wonderful work that you're doing in order to make sure that we're going to reach full enrollment. And so we need your help in order to do that. And we're super excited about the possibilities. But as you see here, every program needs a boost, and we need your help in order to do that. Thank you. Next slide. Glenn Lazan is up for fiscal updates. Glenn, are you online?
Yeah, we can't hear Glenn right now, unfortunately.
That's okay. I'll go ahead and provide the expenditure updates. I'm hoping that you can work out your mic issues. Send me a text or something like that to let me know if you're having difficulties throughout, or if one of your staff can go ahead and finish the presentation for you. I'll go ahead and get us started.
He may have to just sign in again. Thanks.
All righty. All right, well, for the sake of time, we'll definitely go ahead and cover this. So for Head Start and Early Head Start, as you guys see reflected, the period is from December to June. And the award amounts, the funded amounts are there. So 64.8 million for Head Start, and for Early Head Start, 19.8 million. We've expended about 44% in Head Start and about 43% in Early Head Start. I do want to say that for a grant that was scheduled to end June 30th, these reimbursement rates and voucher reimbursement rates, they're really, really low. In the actual contract, one of the things that we, that we're not asking, right? But one of the contractual things we have in there is about how often you voucher. And so, monthly is the expectation. And this doesn't represent operating costs throughout our delegate agencies if you were vouchering on a monthly basis. When we went back to look at vouchers, there's a lot of organizations that have not vouchered in months. And it's really hard for us to be able to tell who is able to spend the money, because we can't see it in our financial system. I know you guys have financial systems that you're using, but I can't see it. I don't have the eyes to be able to see what you have in your financial system. So the only way I can get an update on your organization is through the reimbursements, the vouchers that you submit, and the reimbursements that we provide on those expenditures. So this is really low. And I want this to be the segue for the other conversation that we need to get into, but just understanding that this is really, really low for a grant that was supposed to end June 30th. EHS CCP and also EHS expansion, those are 12-month grant awards, and you'll see 16.6 million for CCP and expansion 3.6 million. And then expenditures are 26% for CCP and 27% for expansion. So seeing as though we're more than halfway through on these grants, again, these expenditures are awfully low as well. And we have to do better. One of the things that we've done, and I know that Victor and Zariah's team, they had been sending out emails reminding our agencies about their grant utilization. And we've also asked for utilization certifications. And so a lot of our agencies have said, we're going to spend the money. I need you to show up, right? If you're going to spend the money, I have to be able to see it reflected in my financial system. So according to my records, the certifications at this point, they haven't came to fruition based off of the expenditure rates of grant utilization that we see here. So across the board, we're trending low, and this is a problem for us. Next slide.
Is Glenn on? Can we hear you, Glenn?
Let me know. Can you hear me now?
Yeah.
We can.
Okay. We're
Is
back. That was very
that's-
strange.
Glenn, I'm going to go ahead and pass it to you.
Okay.
I've already covered the federal expenditures. Okay.
Thanks, Tiffany. Okay,
No problem.
we are here. Modern technology. So Tiffany walked through the federal. So we're also now looking at the Early Childhood Block Grant, which covers the period July through June of 2021. So we're at a 63% rate right now of our total expenditures, both the delegate agencies as well as our operating expenses. So as we continue to move forward with vouchering, please continue to earnestly get them in. I'll be discussing more about vouchering in a succeeding slide right now. That'll be up next. For our GEARS funds, we're at a 17% rate right now. So again, we know that we were not the timeliest in getting them out to everyone. That was discussed at our prior meeting. So again, I'll ask that you please continue to invoice as appropriately for your GEARS funding. And childcare, we're at a point now where we're at 24%. So our budget we're approaching June, so we will be closing out fairly soon in the next couple of months, but our childcare providers do continue to work very well with our internal CCAP team and the finance team to make sure your invoices are paid. So everyone is doing a very good job on that, I have to say, based on your budgeted amounts. Tom, if you could go to the next slide, please. Okay, so some COLA updates and some more interesting news. So we had applied for the COLA grant back in April, and we received some requests for additional clarification, and I have an alert that our time is running slower. So this week, we've received our notice of awards for all of our COLA grant. I have a comment on here that we're waiting for the Head Start and Early Head Start grant, but we received it today. So that's great news. So we've received all of our awards, and we will be issuing an email to everyone by this Friday, and I'll be discussing what will be on that email in a minute. Next bullet point for the closeout, originally for our 6/30/2021 budget periods, final revisions were due to DFSS by 5/14. If we could go to the next slide, Tom, please. So very important communication here. Yesterday, DFSS issued a communication to all Head Start, Early Head Start agencies informing that their current contract has been extended for 1 month, ending on 7/31/2021. And the time extensions are a direct result of our competitive grant, which is slated to start on 7/1. That application process taking longer than expected in our work with HHS. So every HS and EHS award will have a time extension. COLA award is going to be added to every contract with the 7-month period that's associated with the current agreement. Our delegate agencies that are projected to expend at a minimum 75% of their allocated funds at the end of June are going to receive an additional funding amount equivalent to their average run rate to cover projected costs for July 2021 expenses. Delegate agencies that are projected to utilize less than 25% of their allocated grant by the end of June will not be receiving this additional funding based on the projected underspend that they're running on their budget amount. Support service contracts will also be reviewed and based on current utilization. So if we go to the next slide, Tom. Agencies will be receiving an award letter identifying the additional funding, and they will be expected to complete budget revisions, extending the budget for another month, and it will include the COLA award. So finance will be sending out Friday, which will be tomorrow, an email to all of our delegate agencies communicating this fact again, and with a budget template for everyone to communicate, along with another copy of the letter that was sent out yesterday to our agencies, informing them, giving them an overview of the situation. So with the comments to contact either Nicole Roberts of our finance team or myself, and our finance team will be working with the delegate agencies to help them with the budget revisions as needed, so we can get this processed with a due date that all documentation again is submitted by June 30th of 2021 by the end of the day. So regarding any budget questions, things along those lines that may come up, please contact either Nicole or myself. Next slide, please. Okay, again, talking about timeliness of vouchering, we've shared this discussion in prior communications. So again, please do continue to voucher ongoing and as quickly as you appropriately can, and providing the appropriate documentation, very important. We had initially communicated to our agencies and CBOs for the early childhood block grant that the City of Chicago's Controller's Office asked that all be submitted in iSupplier by July 14th. We in finance had a subsequent discussion with CPS, and we were able to obtain a 1-week extension so that we can push that date out 1 week from 7/14 instead to 7/21. I hope that's very helpful for all of our agencies and CBOs, because I know when you're closing your books for June, there's documentation that still needs to be obtained, payroll records that maybe extend through mid-July. So now hopefully you can get all the documentation to be able to submit along with your invoicing for the period through June. So hopefully that'll be a benefit for you as you complete that task. Okay, next slide, Tom. Okay, I think that was it for finance. So thank you all. Appreciate it.
Good morning. My name is Stephanie Cartwright, and I'm the Early Childhood Mental Health Coordinator for SGA and SME, and I'm so happy to be with you this morning. Here is a brief synopsis of wellness planning that we have been working towards, and more detailed information will be shared tomorrow in the HSAC format. So a working definition of wellness, we've been hearing a lot about wellness, and so just a couple of ways to look at it. A state of being in good health, especially as an actively pursued goal. And so that is what we want to make sure that we are doing and making plain and giving assistance with. And the Head Start's definition of wellness is an active process that requires awareness and directed, thoughtful attention to daily choices. Next slide. And so what we want to do here is give an introduction, and then of course, as we move forward through next meetings and thinking, is to deepen the conversation that we have and our awareness around the roles of our early learning programs. And how we can help support children, families, and staff to implement changes so that way that we are well holistically, meaning physically and mentally. Next slide, please. Okay, just some basic things that we know or have heard or at some point, it is proven that children benefit from consistent, sensitive, caring, and stable relationships with adults, right? We know this. And we know that staff who are well holistically are able to maintain positive morale. We want them to be able to report to work and engage in the setting. And so supporting initiatives for staff well-beings, it serves simultaneously in helping the early care environment and educating of our little ones. Next slide, please. And so we just want to begin here, just having a conversation with yourself, reflect, review, and revise, and what can we do to assist? What is it that we need? And so what we're going to do is talk about how we're going to look at supporting agencies in implementing, managing, and maintaining wellness programs. So we have the key steps here. We're going to show a sample guide and we'll have time for some questions. So we're going to do all that in about 10 minutes. So we're going to just keep moving here. And again, tomorrow in HSAC will be a more in-depth presentation. Next slide, please. And so in being directed and thoughtful, the cycle as it flows is, having a wellness leader and committee, of course, doing some detailed needs assessments to come to what is the basic need of the group that you're serving, right? And then what activities would be best suited for your clientele. And then what is the environment like? The expectations, the communication, what are the resources and relationships that you have? How are you going to continue to get input and know that what you're doing is what is needed and that it's working? And so we would do that through evaluation of the plan, and then the cycle continues, right? Next slide, please. Oh, so there is a PDF, and Tom, do you have the PDF of the action plan?
No, I don't, but if you want to share it, I can stop
Okay.
and.
All right, well, I will attempt to bring that up.
Okay.
And in doing that, we do have time for questions. So if there are any questions you want to pop in there while I am attempting to bring up the PDF, that would be great. They did want you to see that. Just a moment.
While Stephanie is looking for the plan, I just want to say that there's going to be another opportunity tomorrow at the HSAC for your staff to receive the SGA training that we're doing today.
Okay, can you all see my screen?
No, we can't
No.
see it. You tried sharing. You have the capability to share.
Yep, I sure did.
No problem. See if we can see it now.
No, I don't see that it is working. I'll do it one more try.
Stephanie and Thomas, I have a copy of the PDF. I'm going to forward it to you right quick, Thomas, as well, just in case Stephanie's not able to pull it up, then you can get it on your end. I'll send it to you right now.
I'll look and see if it's in my.
Thanks, Tom.
in my email. I'm sorry.
That's okay. And in the meantime, I'll just kind of keep talking. And it says Staff Wellness Action Plan, Tom, and it's 10 pages. It was a PDF.
Oh, I have it. Can you hear me now? Okay.
Yes.
I'll share it. Here it is. Let me open it up real quick.
Okay, thank you.
It's like a filling. It's a book fillable. Okay. Here we go. Just 1 second, please.
Okay, no worries.
Okay, here we go. Let's see. Go to my shared screen. Okay. How's this look?
Okay, that's great. And so what we have here is a fillable guide. And of course, you know, you can make it your own, but we want to make sure that we have appropriate scaffolding when we start these conversations. And so like I mentioned earlier, just being intentional about who's going to be the leader and who would be on your team. And moving my phone here, Tom.
Oh, sure. You want me to go down?
Yeah, let's just scroll down just so they can see kind of how, and then we'd be looking at data sources and what type of information would be getting and what areas would be addressed. So this is getting, gleaning information about staff's interest, right? Moving right along. Your staff's wellness goals. So outlining those items with your committee. And then next, we would have, of course, SMART goals. You know, how are we going to measure what it is we're doing and whether or not it's working? So what are our desired outcomes? And you can probably scroll down midway or towards the end. Right, so these are our action steps. So who is responsible? What other support can we be expecting in this area? Who would help us reach this goal? So what is their skill set? What do we need? What resource do we need? And then what is the timeline for that? Okay, and then moving right on down, please. Oh, no, that's page 10. Great. So this is kind of just an overview of what we have in place just as assistance as we start looking at, you know, what things you may already have and what you may need to work on. So if there are any questions at this time, Tom in the box, and then if B would like to respond, or either I can, and then again, remember, we're going to talk about this at length tomorrow in the HSAC setting. Thank you so much. Thanks, Tom.
So I'm going to stop sharing. We're going to go on to another presentation, but before that, Saretha would like to just say a few words, please.
Thanks, Tom. So I was looking also, Stephanie, thanks for that. I don't see any questions in the chat right now. But one of the things I did want to quickly say to everyone is, you know, staff wellness is key. We know that we have been in COVID. We know that there's struggles that are going on, and the struggle is real. That everybody please mute. I'm sorry. Thank you. And so when we're thinking about what it is and why staff wellness, there's multiple reasons to do it. One, of course, just making sure that we are consistently thinking about how we can make sure that our staff are able to be at their best when they're in our programs, but also to recognize the fact that there are some really serious mental health issues going on in our communities, both with violence and also pandemic. And so you couple all of that, those individuals who are coming into your program, who are in your classrooms, are not devoid of either one of those. And so they have issues that they're dealing with personally, and some of that walks directly into the door of your classrooms. And so one of the reasons I'm saying this is we started off in COVID doing trauma-informed care. We had our region doing some work around that. But what I do want to say right now is with the work that we've done, and I know with the work that you're doing, we have had another issue of child harm in one of our delegate sites. Again, we've been here before as a grantee. It's not somewhere that we ever want to be because we don't want anyone's child harm. When we go backwards to November, when we did the conference on health and safety, we were trying to emphasize the point to everyone about health and safety and making sure that we had our hands on the pulse of what's going on in our classrooms, that we had systems in place monitoring. Now what we're talking about is staff wellness. We want you to understand that you've got to think about your staff's wellness and their ability to be in classrooms with children and other staff within your facilities. But again, we've had another incident of child harm, and that child harm, again, non-negotiable on a Head Start grant, as it should be non-negotiable in our life and in our world and in our work, period. But what this also means is that's a deficiency on our grant. And again, you know, we understand that there is, you know, times in your classrooms where your teachers are indeed stressed. But what's your response mechanism around seeing teachers that are stressed? And what are you doing to make sure that you're able to respond to that? Have other individuals go in, make sure that they're able to come out if they need to. What's your plan? What's your program? What's your structure? And right now, what we're going to be doing and what Stephanie just presented to you is about all of you doing a staff wellness plan, making sure that you've talked it through and worked it through within your organization about what kinds of things you have. You may have an employee assistance program. It may be something that you have attached to your health insurance. There's a lot of different things that we're doing. But again, what's our response? What are we doing? How are we ensuring? And what are we doing to make sure that our staff understand that we care about them and their wellness? And so these are the things that we're gearing up, and we're making sure that everybody's aware of what we're talking about. So again, Stephanie, thanks for your presentation. As she said, there'll be more information at the HSAC where they'll be talking about that as well. But again, this is a conversation that we're going to continue to touch on as we go through the summer and into next program year, because we really, really need to be thinking about health and safety at all fronts, at all times in our programs. And we need to be making sure that we are able to do exactly what it is every one of you I know intend to do. And that is being that nurturing support space of safety where children and families can come and learn and grow. And so we've got to make sure that we're able to do that, and we'll be emphasizing that. So thanks again, Stephanie. I'm going to go ahead and give the mic back and allow us to go to the next presentation. I don't see any other questions in the chat. So I am going to go ahead, Stephanie, and move forward to the next one.
Good morning, everyone. My name is Laura Bilbrey. I work with Teaching Strategies. And I just want to make sure that you can see my screen and hear my voice.
Yes.
Yes, we can hear you.
Thank you. Thank you so much. And thank you for your comments, Sarethel. Stephanie, I was listening to your presentation and I thought we could take our own wellness, but that whole what's interesting, where our interests, and set some goals and some action steps, and probably use that same framework for some of the things that I would like to share with you all this morning. As I said, my name is Laura Bilbrey. I work with Teaching Strategies. I've been associated with Chicago and DFSS for quite some time, but you probably know Deb Zapolak much more. She's kind of the face of Teaching Strategies locally. And she presented at this meeting, I think it was 2 times ago, and really looking at some outcomes data. We're going to circle back on some of that, but also cover a little more holistically. So thanks for the time to be with you this morning. You know, Teaching Strategies has been around for a really long time and a part of the DFSS Head Start implementation for a very long time. And we've changed and you've changed. And I hope you'll be kind when I ask this question, but really curious, when you think of Teaching Strategies, if you'll enter into the chat what you think of. I can be tough. I really want to hear your answers. No one thinks. We'll give it just another minute. Curriculum. Thank you, Angie. We are the and gold. Assessment, which is gold is our assessment. The creative curriculum is ours. William Moore assessment, lots of assessment. It's interesting, research-based curriculum. Cynthia, you're going to be my new best friend. Curriculum and assessment, observations, benchmarking, some great, oh, someone said how to help every child be successful. That warms my heart, and really appreciate your comments there. So Teaching Strategies is an organization that started out as the publishers of the creative curriculum. I'm older than I look, I sometimes say. I've been using the creative curriculum since it was on VHS tape. So we've been around for a little bit, and we continue to evolve our content and our resources. And I really want to just very briefly, for a long time, it really was the creative curriculum in gold. Or cc.net for those of you who may have been around that long. But when COVID hit, it gave us a real chance to listen so much more closely. It changed everything. We all know that. And so we pivoted. Many of you may be familiar that we launched the Healthy at Home initiative, which had some of our Ready Rosie videos and some of our family resources. And we spent late last spring and early summer really thinking about how do we need to enhance all of those offerings? How do we improve and incorporate family engagement in a more purposeful and intentional way? One of the things that we have as a solution at Teaching Strategies is Ready Rosie, right? Which are modeled moments of real families interacting with their children. Well, that's it, and it's amazing. And at the same time, we need to give you one ecosystem where you can come in, you can assess children, you can get family input on that, you can engage families in supporting their children's development, where your teachers can learn, where they're the curriculum resources. And then you as a program director and educational director have the access to reports that are going to help you talk about your program and set some goals. One of the things when Deb and I were talking about this presentation, gold itself, which is oftentimes what people think of when they think of teaching strategies, that's just an output. Assessment data is just a result. And if we want a different result, we have to change the input. And so what we're trying to do as an organization is to bring that all under one umbrella to give you access to all the different inputs that you can tailor make for your program, for your sites and your teachers and children, to try and shift that outcome or the goal data and make sure that we're achieving those goals. So within DFSS, as I shared, you all have access to the creative curriculum in print, the creative curriculum cloud, which has moved that to digital, and that is the kind of landing page, my teaching strategies for all of these resources. Ready Rosie, which are those modeled moments. There are family workshops. There are abbreviated family workshops called Give Me Tens. Getting families to come and spend an hour with you is really hard. Most of us can give 10 minutes and they're really short and snappy and impactful. So I encourage you to look into those as you start to plan for your new program year and how you really want to support families. Gold is going to be that outcome, that student assessment data. And then we have professional development. This is a screenshot of within the ecosystem, what we have digitally or our online professional development. But one of our favorite things about the implementation in DFSS is the ongoing commitment to in-person professional development. Are those new teachers? Are they returning? Is it the Gold TA suites? Is it the coaching initiative? All of the things that we're able to do to really help you and your staff think about how do we change those inputs to make sure we're getting the most beneficial outputs. So I want to spend just a minute, and I apologize if I think we're short on time, and so I'm going to try and go as fast as I can. I'm never short of words. But when we think about gold, it is the assessment tool. It's where we put the observations that we have of children. But when we think about this whole cycle, the question we start out with is, what does this child know? What can they do? It doesn't really matter what the kindergarten readiness benchmark is. The child is here and development is sequential. They're going to have to go through all of these phases to get to that K readiness. And so we want to meet them where they are and see what it is they're capable of doing now. And we really figure that out by taking those observations and collecting that documentation within Gold. And then once we have that information, we assign those preliminary levels. We look at those examples of their behaviors and compare that to the research. How do I compare this child's development, their behaviors, their knowledge, their skills with other children of their age? What does the research tell me? And then that gives me the information I need to then start to tailor make those inputs, right? So I'm going to skip over to here. How do I summarize what Gold is telling me and use it so that I can really change the input? What can I do differently? Because if we don't change the input, we're going to continue to get the same output. So I want to share with you something that you've probably seen before in different formats, but this is a high-level synopsis of some of the information Deb shared on the outcomes report a couple of months ago. So this past fall, when children, our 4-year-old children, were assessed using GOLD, this is the percentage of children that were meeting the widely held expectations for a 4-year-old. So you can see that children were coming to us possibly for their first year with us, possibly they've been a part of early Head Start and Head Start as a 3-year-old as well. But this is where, as a whole, 4-year-olds were. And we don't want them to end the year at that same place. So we have to think about, what does this mean? You know, what I think, going back to Stephanie's matrix that she had, I think it's an interest, what interests here? When you look at this, what interests you? What piques your interest? You know, each of your agencies in DFSS itself has a theory of change. Is it, what's going to make the biggest difference for these children? Is it social emotional? Is it math? Is it cognitive? You know, research has some implications, but you can probably find research that will say all of those things are going to move the needle. But thinking about with your team, you know, what is where do we want to focus our investment? Where do we want to change the inputs trying to get outputs? And once I do that, DFS is giving you all of these resources to try and think about those inputs, or the possible resources to use as inputs. Right? We have the creative curriculum that allows us to differentiate all of our instruction and focus where we want. But it's important we do that with fidelity. And we need to make sure that we're starting with the physical environment, that we're looking at the daily structure. You know, the intentional teaching cards, our experiences, and the studies, those are the daily resources, and they're very important. But it's the environment in which we do that, the physical environment, the resources children have access to, the emotional environment that teachers who hopefully are taking care of themselves are creating. You know, we know all of this through the work that you do with the class and Teachstone, and those interactions and how much those matter. So we want to use the curriculum to fidelity. If we have data, it doesn't, you know, if I want the full benefit of helping this child excel and grow as much as they can in the time that I have them, I have to work in partnership with their families, right? I may have them for a year, possibly 2 years, but their families, who's going to support them the rest of their lives? That's where family engagement comes in, and it's so important. So looking at the Ready Rosie modeled moments, how can you share those with families? What are you sharing? How are we doing those really impactful family workshops to help them understand their child's development? Every family does their best by their child, but it doesn't come with a how-to manual, right? And so it's our job to help them get access to those resources. One of my favorite reports that we have within Teaching Strategies is the Development and Learning Report. It is short and it's snappy, but each area of development, it talks about what this child does now and what they'll do next. And that comes from the progressions. Then we have this whole host, including the Ready Rosie modeled moments, the Family Mighty Minutes, the development and learning activities, of things that we can share with families that they can help their child, they can do at home with their child to help them reach that what next. And then thinking about your teachers and their professional development. You know, most of you have been using GOLD for a long time to assess. And if you are consistently seeing that you're not getting the gains you would like in literacy or math or social emotional skills, then let's think about that. What does that mean? If we don't change that input, we're going to continue to get the same output. And so we really hope that you feel supported by DFSS and by the solutions that they have selected from Teaching Strategies to give to you, so your teachers have those in their tool belt and they can pull out and use what is most appropriate at the most appropriate time. I know I'm running long, but give me 1 second because we're not done innovating. And I want to share with you, if I can, really quickly. Hopefully you have all been in and logged into your My Teaching Strategies account. I was going to dig in. I won't, Sarethel and William, I promise I won't keep us too long, but in the library, every bit of content that we have published is there digitally for your teachers. So every single one of our studies, we introduced some new studies this summer, some shorter investigations. There's the guided edition, which has some embedded coaching and really links curriculum and assessment and makes it much more accessible for teachers. So I would encourage you to have a look there. Teach us where we plan. That's one of those inputs. Let me plan the most appropriate things to help these children. Assess is clearly where gold is. Under the Develop tab is where your teachers would access their online professional development. As an administrator, there's a whole section on reporting that you can get. You can run classroom reports, you can run agency reports, and really gain some insights as you start to look forward to the new program year. And if you think it would be helpful, Deborah, I would love to come back and talk about reports with you on another day. And then within the family tab, I can log into Ready Rosie. That's where I find those development and learning plans. It's where I find the at-home guided learning plans. We have a family app so that families and teachers can communicate back together. There's an e-reader with over 200 books, both in English and Spanish, that families can access from home. And they don't have to read it themselves. There's an audio book part of it as well, so that families can follow along. So just really encourage you to take advantage of the resources that are there. As we innovate and get ready for back to school, when you or any one of your staff logs into My Teaching Strategies, you'll see this little, I'm old, again, looks like a film strip reel to me. But if I click there, it's where we are statically holding, I'm going back to, give me 1 second, I apologize. That is where we are statically keeping updates on the platform. So we have these 2-minute videos to help you and teachers know what's new and what's coming their way. We've been doing hour-long webinars. We know time is precious. So we then go after we do the webinar and give you a 20-minute recap, right? With just the headlines and not the detail. We just want to make sure that you and your staff have access to everything you need to be successful, plan for the new year, and then really reach new heights for next year. So you'd find those things down in that bottom corner. And last but not least, I would like to close. Aren't you proud of me? We're getting through what was undoubtedly 45 minutes worth of content a little fast, but just really want to move on. I hope that each of you will commit to action. Think about, what am I going to do different in my program this year to help reach different outcomes? And then one of my ultimate professional heroes and human heroes is Dr. Marian Wright Edelman. And a quote from her is, if we don't like the world the way that it is, we have to change it. And I think the same could be said for our program. We know we want every child to leave us meeting and exceeding any expectation that anyone would have of them. So let's make sure that we commit to those changes to help them achieve that.
Thanks, Laura. All right. Again, I think from some of the things that you've heard, again, I just want to remind everyone, we're here as a support to you. We are constantly thinking about what else we can put in your hands to make your work better there on the ground, to ease some of the stress. And I know, and I thank Laura and the many conversations that we have had and the work that they're continuing to do to make their system really work for you, for those of you and teachers in classrooms, and then for us on reporting and you on reporting. It's just the constant thought process that they're going through to make their tools really those kinds of tools that will help us do exactly what was in that last quote. And I'm going to use that as I finish in this and say, again, if we don't like the world that we are in right now, and I said earlier that we had an incident of child harm, if we're saying we don't like that, if we're saying that we don't like what you saw as far as where children were as 4-year-olds, then it's our job to change it. It's our work to do the work to change it. It's for us to look and constantly be thoughtful about what else we need, what else we can do, and what else do we need to bring to the table really to make this work best. And again, lastly, for me, everything that we do is about children. It's about making their lives better, making sure that those children who come to us in our early Head Start program or our PI program is 6-8 weeks old, that when they stay with us and we work with them, that we're doing everything that we can so that when they transition off to kindergarten, they are ready to succeed, and that everything that we do will hold and stay steady through those first years of education within the public school system. That's the goal. But in order for us to see that as an outcome, then we have to acknowledge that there's work that we need to do and we can do better. Again, looking at that last quote, if we don't like what we see, then we've got to do the work and we've got to make the change. And so I invite all of you to join with us in making a change so that we're doing better than we are today for all of our children and families that we serve here in Chicago. So if you can, go ahead, Tom, and I'll see what the next slides are that we have. And again, thanks, Laura.
That actually ends the presentations. And so we're going to go into Q&A. I know that there's been a lot of typing in the chat. And so we want to go ahead and filter through those. I want to make a quick announcement because we had Dana Gardner from IFF on here maybe a couple of months back talking about some of the grant opportunities for expansion of facilities, whether it was renovations, enhancements, but specifically they wanted to target our south and west sides. Not to say anybody else can't apply, because you can, but I think that going with the mayor's vision about revitalization and improvements on the south and west sides, I've been in contact with Dana, and Dana mentioned that the applications are very low from communities on the south and west sides. And so if you have a facility in these areas and you are in need of improvements to infant toddler programs, whether it's expansion, whether it's enhancements, those type of things, there's an opportunity to receive up to $50,000 to be able to help you with those type of renovations. Capital improvements are hard to come by. And so I'm just going to go ahead and urge you to make sure that you are following up on the information from IFF. You can go on their website and there is an application process, but you know, I'm urging you, go ahead, let's go ahead and apply. But we do have some questions in the chat, and so I want to make sure that we're going to get to some of those. There was a question about the PI slots. Somebody wanted more PI slots based on the information that I talked about in terms of low enrollment. One of the things I do want to go ahead and just clarify, even though I talk about low enrollment, I want you to understand that those slots currently belong to a delegate agency. Okay, I'm not sitting here holding on to PI slots. I want you to know that. They're with the delegate agency. It's just the delegate agency is not fully enrolled. So in order for me to give you or anybody else a PI slot, I have to take it back from somebody else. And so what that means is, of course, reducing their funding, right? Because they can't serve the children, and then increasing yours because you can. And I'm making this very general so that the person who asks the question understands the process that has to happen. So at this point, I don't have any PI slots to give unless I take back from somebody else. So I want to be very clear about that. However, you can always fill out a slot or reallocation application. If you need a slot reallocation application, contact Victor or myself, and we'd be more than happy to go ahead and get you the application out. But it's not that easy in terms of me just being able to give you slots that I don't currently have. I would have to take them back from an agency who is underutilizing them. Because of the pandemic, we have not been taking slots back. But as we're talking about the need to be fully enrolled, then, you know, in full transparency, I'm going to have those conversations with agencies who can't utilize the slots. So that is a conversation that will happen, you know, but we're hoping that we can go ahead and have those slots filled with your cooperation. And so we don't have to have that conversation about reallocation of those resources. Right. Let me see what other questions.
Hi,
Yeah,
Tiffany.
IFF. So if you go to, and I'm going to put the website in here because that may be helpful. I'll put it in the chat. It's iff.org, but I'll go ahead and put it in the chat. Feel free to go to their website.
Hi, Tiffany and everyone. I was monitoring the chat as well, and I don't see any other questions except there was a question, just one really. It was sent to me, and then I shared it with everyone. It was about seeing the opportunity to see the second choice when person applies for a Head Start program, if they are able to see that second choice by
With the
parents.
preschool online application?
I believe so. I'm trying to find the question.
Yeah, I think I saw that earlier too. So that's earlier in the chat. Is Craig on? Craig should be able to address that.
Nice.
And no, I don't think Craig is on.
Okay, so the question, whoever asked it about the ability to see the second slot, or the second choice in an application, just send me an email. I don't believe, until the parent declines the first choice, I don't think you'll have access. I believe it's on the 1150 report, but I don't believe you'll have access to it unless the parent declines the first choice, and then you'll be able to see it. But I could be wrong. Send me an email and I'll make sure that I run that by Craig so we can be sure. All right. If there are no other questions, and I don't see any others in the chat, keep me honest. If you have a question, you can unmute and ask the question.
I don't see any in the chat at this point, Tiffany.
Yeah, I don't either. And so I think we followed the appropriate etiquette, right? We waited at least 30 seconds or more. Peter's laughing with me. Exactly. So I think we've done our part here. Yeah.
All right, looking at the chat box, seeing no raised hands, trying to make sure that I'm covering all my bases. I'm sliding across to make sure that nobody's raised their hand that we missed. What I'm going to say again to everyone is I thank you. I know every time that we bring you together, we're trying to give you information that we believe is useful, that will help you in your work and your staff in their work. With that said, I'm hoping that you're finding these meetings something that is useful on your part. If you have something that you can think of that you really need or want brought before you, you can definitely send me an email so that we can think a little bit more about how do we make sure we bring that to you as well. Again, looks like Tiffany's hand is up really quickly, so I'm gonna go ahead and let her chime in really quickly before I close the meeting. Go ahead, Tiffany.
Thank you, Sarethel. I don't want it to be my announcement, but what I'm going to ask for Madeline to do is, Madeline, if you feel that it's appropriate, you know, can you go ahead and speak? Oh, and I also want to congratulate Beverly Echoes too. She is the new executive director at Tuesday's Child. So congratulations on your position. We definitely look forward to working with you, Beverly.
Good morning, everyone. Yes, as some of you may have heard, I have submitted for my retirement. So this will be my last meeting, as my effective retirement date is June 30th. I'm currently on countdown. I have been blessed. I really have been truly blessed for all the opportunities I've had throughout my 35-year career, of which 20 and a half were with the city. I am proud and thankful for the different roles I held when I worked at delegate agencies. Each role has a really special meaning to me. I am proud to say that I started out as a home visitor. Then I became a teacher. Next, I was a site director. And my last position at a delegate agency was as an education coordinator. At the city level, I also had a lot of different roles. And it's truly been an honor to serve all of you on behalf of staff, children, and families. So although I will miss my colleagues, you know, I'm really excited about my retirement. It's going to give me the opportunity to dedicate quality time with family and friends. It's been a really difficult 14+ months during this pandemic that made me really reflect the value of time. Life is short and we need to cherish every moment. So that's what I plan to do. I plan to relax and pamper myself, go back to bike riding, have some time, some girl time, dates with my friends, continue to spend time with my mom as I'm a current caretaker, and spend more one-on-one time with my 4 grandchildren who lost their dad last year. So my summer is going to be quite busy because they're lining up to come and spend time with me. I will cherish all the relationships that I have developed throughout my career. And I wish everyone the best and want to thank everyone for the work you do every day for children and families in Chicago. So I'm sure our paths will maybe cross. Once you're in Head Start, it's like a cult. You seem to always cross paths. And so that's my announcement. Yay. Thank you.
It's hard to say thank you, Madeline, for leaving me. But thanks for letting everyone know that you decided to leave me. But again, we've been congratulating her since she's acknowledged that she's ready to move on to retirement, and have been thanking her for all of her years of service, both here and, as she acknowledges, before coming to the city, her work in community on behalf of children and families. I can't wait to be where she's going, but anyway, I'll talk about that later. So thanks again, Madeline. So just a couple of things before we close, and I see a lot of best wishes coming in the chat box. Continue to do that as I'm talking here. I just wanted to ask for a couple of things from you all. And that is that, number one, that you reach out to your team leads. One of the things we're trying to capture are the events and things that you have planned at your agencies out in community. I know that we did send out one email because we're trying to make sure that we're building them into the calendar, making sure that the mayor's office is aware of different events that are going on. There's a lot going on in community. We know some of it not so positive. We know that the city of Chicago has put together some concerted efforts in some of our communities where they have, CPD working together with those program providers in the communities, the community-based organizations like yourself and other providers, just to band together to make a statement about stopping the violence that's going on. And so that's one of the things that's going on. And so as I'm sending you emails, if I have staff reaching out to you, asking and inviting you to attend, please do so. Be there, be the voice that lets everybody know that we really, really want all of this and all of these things that are happening in our communities to stop. Every time I listen to the news, and I'm drawn to it because I need to know what's going on in community, because you guys are all out there and I want to know what's happening in and around you. But just hearing about the mass shootings and everything that's going on is just, it's too much. And so, if we want to be the change, we've got to be the change. And that means we've got to come out of our spaces sometimes and be out there letting people know that we're here, and that we want our communities to be safe for our residents, for our children and our families. So again, as we're reaching out to you, please let us know about your events. Right now, I'm asking you to reach out to your team leads and let them know what you have planned. Give us the information. If you're planning any activity, we want you to tell us about it. Just give us all of it. And we'll make sure that, if it's something that is in a community where we're doing some work in the mayor's office with DFSS and other departments are doing work, we'll make sure that it gets included in that calendar. So again, please continue to do that as you're planning over the next few months. The last thing I do want to just ask everybody to do is just mind your email, please, as we're sending information out. And making sure that you're able to respond. And if there's something that we're sending, I know I sent out an email to executive director, CEOs recently or this week, making sure that everybody knew about what's coming up with the extension of the Head Start grant. Once we have information, we're sending information out. And I know everything that comes into your email box isn't necessarily for you. And so my ask is that you immediately let the person who's responsible for doing whatever that is, let them know that we've sent this out and we need responses. Again, I want to say from me, I know some of the timelines that we're giving you are tight, but we have to do that in order to be able to get our awards out to you. We just don't have the luxury of weeks or a month, especially in this case for Head Start, Early Head Start. It's a tight turnaround. We need everything in our hands. And I'm just going to reiterate that date by June 30th of this month. We need everything in. And so that we can make sure that everything's in and can go forward in fiscal so that we can get some of the contracts and everything and awards out to you and expediting those. And so, again, I just encourage the responsiveness on your part. And if you have questions, we are always available. You know how to reach us. If anyone else, and I've responded to a couple of people wanting to make sure they have the correct email for me. If anybody else needs it, I'm looking at the chat and I'm definitely sending that out so that we are always reachable and we're always available. We are your supports. We're hand in hand with you on this, and we want your world to be better, and we want to do everything that we can to help you do that. So keep in touch with us as we'll keep in touch with you, and we'll be talking very, very soon as we have our next EDPD meeting next month, all the way in July, which is past the halfway mark in 2021. So my last piece I will say, and I know people have been waiting to hear about who the commissioner would be here at DFSS. I will say that Brandy Kanaze, who was the first deputy under the leadership of Lisa Morrison Butler, has gone through multiple steps from being appointed by the mayor to going through the budget hearing, and she has one more step to go through. But so far, everything has been positive, and right now we are acknowledging her as the next commissioner for Department of Family and Support Services. Again, her name, Brandy Kanaze, many of you have met her. She's been at meetings before, but she's been here in the department and has had youth and seniors under her. So many people both know her face and also her name. So again, everybody, please be safe, stay healthy, and do everything you can, as you always do, for all of your children and families. And we'll talk soon in July. And you can't believe I'm already saying July, but this year has definitely passed us by really, really quickly. So take care, everyone. Have a great rest of your day, and we'll talk soon.